I would rather spend more on Medicare than on the fucking military, because with the
Of course
military,
you would.
all
Of
that
course you
money,
would.
all that money just goes to causing death. Now, how about we start, healing people? Start causing life.
Well, here's the thing. I know I read that there's some idea that the health of a nation reflects our healthcare system. I don't think that's exactly true. I think the reason why Americans are so unhealthy on average is not because of our healthcare system, but it's due to the American lifestyle. Americans don't, like in Europe. They walk a lot. They eat better. Everything. They exercise more. I mean, it may sound ridiculous, but it's true. They walk everywhere. In America, we drive everywhere. We eat like crap. Tons of meat. And I'm no vegan, but at the same time, a high meat diet is not the best way to go. And so I truly do
Well,
think that the reason why America is so unhealthy is not because of our healthcare system, but it's due to the fact that Americans are just plainly unhealthy.
Yeah.
well, the type of healthcare system doesn't really affect, how inherently healthy the people are. Is
Yeah, I just saw.
the healthcare system, uh, treats it, how good our healthcare system, ensures that we don't have so many people fucking dying in the streets due to preventable causes like, cancer and stuff. I mean, we're still having people, getting rejected, having their cancer treatment rejected because they had fucking acne when they were teenagers.
Well, that's more of a beer. Well, I think that's more. Wait, what? They had somebody getting rejected for cancer treatment because
There,
they
there,
had
there, there,
acne
there's a
problems.
Yes.
there was a lady who was diagnosed with skin cancer, and her health insurance company rejected her, denied paying for her treatment because she had acne when she was younger, and that was a pre-existing condition. You know, you
That
you you,
I
you
have a
say
question
you
here.
say acne, we say cancerous skin lesions. So payment denied.
I have a question. Are you just quoting Kyle, or did you actually read the story yourself?
Huh?
I'm not trying to be snarky, but are you just quoting Kyle on that story, or did you read the story yourself?
I read a story some time ago, and that's the gist of it.
Okay.
yeah.
I'm just
I
curious
mean, that
because
sounds
it's
a
the
little.
exact same thing that Kyle Kalinske has said during his debate with Razorfist.
A
Well,
woman who got that makes no sense. That makes no sense to me. I mean, why would a insurance company reject the thing that they are meant to do? I mean, that
But
is their business.
that's how they make money. They make money by denying treatment, because there's two ways of rationing healthcare. There's rationing it based on need, which is what single payer countries do over in Denmark and Iceland and rest of Europe. Basically, the rest of the modern industrialized world. And then there's rationing it based on how much money you have. And if you're a millionaire, a billionaire, if you're upper class elite, America's got the best healthcare system in the world, because you could just beat your money cock to get yourself healthy. But if you're poor, you're up shit's creek, because you have to rely on the mercy of the health insurance companies to get the health care you need. My dad,
Well, the reason.
my dad had to wait like 2.5 years before he finally got his knee replacement surgery, because he had to go through all kinds of hoops to find some way of paying for his knee replacement surgery, because the health insurance company in 2009, to save $1,000, they only paid for a partial knee replacement when he should have gotten a full knee replacement. A few years later, he had to get the full knee replaced.
So L'Oreal rejected a beauty blogger because of acne. Is that the story that you're talking about?
Uh, probably.
L'Oreal.
I don't know. I forget the name of it.
Okay.
Yeah.
L'Oreal apologizes to woman for rejecting her over skin issues. Didn't in the anecdote, didn't you state, and Kyle Kalinske for that matter, that she died or something?
I heard she died.
Did she?
Okay. Well, I don't know. I mean, this is a very recent article coming from a website called thisisinsider.com. L'Oreal apologizes to woman for rejecting her over skin issues. Let's take a closer look at this.
What year is that?
March 2nd, 2018.
Oh no, that can't be the case because this happened a few years ago.
Okay.
Well-
I see. You know what the issue is that I have? You always go mentioning what was it? 40,000 a year die because of lack of care or being
Between 36,000 and 45,000 people dying every year due to lack of health care. Last year, I think it was 36,000. The year before was 45,000.
Okay, so yeah, it's about around 40,000. The reason that I wanted to mention this like a long time ago, I can't whenever you would be bringing up that stat and whatnot, but I never really had the opportunity to. The thing that I have with that statement, 40,000 a year die because of lack of health care. Are you sure? Are you sure that they got rejected by the actual medical care the doctor? Are you sure that they actually got rejected by the doctor within the ER because they did not have insurance, or did they just happen to die in the ER, and they just happen to not have health insurance, and so therefore they get counted in that statistic? That seems kind of odd for me. You be saying that in 40,000 cases, each and every single doctor that those 40,000 gone to rejected even taking care of them. I mean, we're not talking about the insurance agents. We're talking about the doctors.
What point? I'm talking. This stat's talking about people who have cancer and shit, and they can't get the treatment they need because their health insurance company will pay for their treatment. They can't afford to pay for their their treatment or for whatever other disease or their disease goes undiagnosed because they can't afford to go to a fucking doctor.
Okay, so they decide for themselves that they can't afford the doctor, so therefore they don't go at all, or they do try to go, but the doctor just straight up denies them because, oh, you don't have insurance.
It's illegal to let somebody die.
I wanted Ham to answer the question, Aspie.
I'm not sure what kind of question you're trying to ask.
Are you saying that they did not go to the doctor to take care of their cancer because they did not have health insurance and they thought, oh, I can't afford it, so let me not go at all? Or did they try to go, but the doctor denied them because, oh, you don't have health insurance? Well, can't help you.
Yeah.
I mean,
that seems
your ass is dead.
Because that seems quite odd to me. I mean, I don't mean to bring up personal anecdotes as a complete and utter debunking of this, but my dad, he does not have health insurance even to this day. Certainly not during the time of his strokes. And every single time he went to the ER, he got taken care of by the doctor.
Okay, I just looked it up.
And he's still alive to this day, by the way.
It's from the Harvard Gazette. New study finds 45,000 deaths annually linked to lack of health coverage. This was published in 2009. Uninsured working-age Americans have 40% higher death risk than privately insured counterparts.
So it just says linked to lack of health insurance.
Lack of health insurance.
Okay, so It doesn't mention specifically whether they did try to go to the doctor and the doctor denied them because they don't have insurance.
I mean,
Or
you'd
they
have,
just
you'd
decided
have
of
to
their
read a
own.
study.
Because it seems rather ambiguous.
Yeah, that's my thing about the whole statement of.
I mean,
47.
it sounds like, their treatment wasn't paid for. That's the problem.
So you're saying that their treatment had to be paid for beforehand before the doctor would ever want to even solve their problem.
I mean, here's the thing about doctors: they're legally obligated to stabilize you, and after that, it's up to them whether or not they'll continue treating you. Like, have you not heard of the cases where if a patient isn't able to pay for their treatment, that they'll just walk them out? I mean, there was a case where a woman who was wearing nothing but the hospital gown was sent outside in freezing weather to basically freeze to death because she wasn't able to afford her treatment anymore, and a good Samaritan just happened to pass by and pick her up.
So what is it that you're saying exactly? That the doctors left her for dead intentionally?
Yeah, pretty much. I mean, it's someone in the hospital.
Someone in the hospital.
Sounds odd.
Okay.
Say, I guess maybe to slightly change the subject, what do you think about Canadian healthcare, Ham? Like, is that something we should...
It's not really a change of subject, but go on.
I know, because actually it's kind of brought it up because, yesterday I refilled this prescription for...
Can you, reposition your head cam? Because I'm like...
Oh. Hi, yesterday I refilled my prescription for for this blood pressure medication, and it actually cost me $4.70.
$4.70?
Yeah.
400?
No, $4.70.
Yeah, that's I did not think he was. Yeah, that sounds reasonable. Actually no, that doesn't sound reasonable. It sounds cheap.
Yeah.
Where do you live?
I live in Vancouver.
Canada.
Vancouver, Canada?
Yeah.
Well, you guys have half to the third. You guys have a third to half the pharmaceutical costs that America does, which is why Bernie Sanders and Ted fucking Cruz were advocating for an amendment to import drugs from Canada, for those massive pharmaceutical savings. Because America, not only do we pay the highest healthcare costs in the world, we also pay the highest pharmaceutical costs.
Actually, I did some research
world.
about that. The reason why Medicare, why we pay so much about healthcare, the biggest reason behind wasteful spending is unnecessary care. A lot of people who are unemployed go to they're sitting around and they start obsessing about their bodies. Oh, am I sick of this? Am I sick of this? So they end up going to the doctor and getting treatment even though they don't need treatment. And this is going to sound a little pretentious, but
yeah,
socialized health...
that sounds like horse shit.
No, it's not horse shit. It's the big reason why is because of that. It was in a study, and also I think socialized healthcare kind of weeds it out because people have to wait so long because, as you said, it's need based. So people kind of just naturally weeds all the people out who would go there for unnecessary care because it takes 2 minutes.
I mean, there can't be enough people with a Munchausen disorder or OCD that they're like, oh god, I feel sick.
And I don't think it's like that. I just think they start. I think it's not exactly Munchausen syndrome, but it might not be Munchausen syndrome in that sense. But they start getting that. But they start getting that way. They start getting a little bit paranoid about themselves. I can find you and link you the study if you'd like.
I mean, here's the funny thing about when Ryan was talking about the Canadian healthcare system, I thought he was going to start talking about wait lines, And yeah, Canada does have a problem with wait lines.
Yeah.
But here's the thing: you can't even get onto the fucking wait line here in America if you're poor.
Most of them just go through the emergency room.
Or they fucking die without treatment.
I don't think that's true. But you think hospital can't just let you die.
They stabilize you. But after that, you're up shit's creek. Unless you can pay for your treatment. Whether it be, cancer, diabetes, kidney failure, whatever.
I think we're arguing the wrong. I'm not saying the American healthcare system is perfect. I mean, nobody is. I mean, everybody hates the American healthcare system. But what we disagree on is how to fix it. I would prefer a more free market solution, while you want a more a state-based solution.
Well, here's the thing: the American healthcare system is a free market system.
Not completely. Not completely. There's more government regulation. There's a ton of government regulation in the healthcare industry. A lot.
What about the mandate?
You have to spend 80% of your gross income on healthcare. What a tragedy!
Hey, one at a time now.
It's the same reason why college costs are so high. It's because the government subsidizes college loans. It's the same with healthcare. The government subsidizes medical treatments. That way they can jack up the price as much as they want.
Then how come single-payer nations have the lowest healthcare costs in the world?
Because the government pays for it all.
Yeah, and I'll ask again: how come they still have the lowest healthcare costs in the world?
Because the government has it completely. The government it's a thing. The government insures everybody.
Oh, so you're saying because the government pays for everything, they negotiate down all the prices that they lower the healthcare costs. Well,
the government.
Well, shit. I mean, how are you arguing for a free market system?
Because it can make the prices lower, it can increase
No,
supply
it doesn't.
and create and
It obviously doesn't.
Well, another reason is because of the unnecessary government. Doctors have to go through very unnecessary what is it called again? Education, and the government only takes in 100,000 training doctors per year. So that causes a very lower supply. In order to stimulate and in order to create more better doctors, you have to have more. In order to make healthcare cheaper, you have to increase supply. So,
anyhow, guys, I guess I'm going to log off. I'm going to check out my friend's stream.
Me too. I gotta do some school stuff. So bye.
Yeah, actually, if you are interested, I can maybe link her to her channel. She's a Giovanna Liviana.
I'm black.
Yeah, Aspie had left. I probably will end this stream pretty soon. I mean, not much I can offer in the healthcare debate at this moment. I mean,
yeah, there's nothing conservatives can offer to the healthcare debate. I mean, the healthcare debate question has already been won by the left. Single payer system. It's unacceptable that we haven't got it passed yet.
Whatever about your objectivist attitude.
Well, here's the thing. Every time you look at it, if you compare the results between the American system and the system.
See you later, Ryan.
Have a good night.
And the system in Denmark, or the system in Iceland, or the system in the UK, they always kick our ass in almost every category. There was a study done by the Commonwealth Fund where they compared America and 10 other nations with single payer. We were routinely either bottom of the pack or the next rank up. I mean, there's only one category where we did relatively decently at, and that was like basically wait times. Because, if you have enough money, you do get the service faster.
Well, I guess that comes to the question of would you be willing to chip in the extra dollar to expedite your own service or not? I mean, it's making it sound like that you don't have the option at all in Canada. Maybe Americans just prefer to have that option to get a speedier care for a higher dollar.
Yeah, but no, well, Americans just, they actually did a study on this. I think it was by YouGov. When asked whether or not they want single payer framed as Medicare for all, it has like majority popularity. It actually has a plurality of support even among Republicans. More Republicans, agree with Medicare for all than disagree with it.
What are you saying? That when it was framed as single payer, when they used
when it's framed as Medicare for all.
Well, it was framed as Medicare for all, but are you saying that when they use the term, or did they initially use the term single payer and they got a different result or something?
I don't know. I mean,
I don't know.
Okay. Among conservatives, that they, folks on Fox News slander, single payer systems, as evil socialism.
There was a Rasmussen poll that I had come across a while back where I think it was like a slight, well, not even a majority, like a plurality, more like it was 47, high 40s of percentages of people that disapproved of the idea of single payer health care, whereas it was like a mid 30s.
That's pretty impressive from a Rasmussen.
Where it was like mid 30s approving, and the rest, I guess, it just had no opinion. I mean, if I'm remembering the poll correctly.
I mean, Rasmussen is, widely known for having a right-wing bent. I mean, they're often cited by Donald Trump as, look how popular I am. Even though the majority of Americans hate my ass, this poll says a majority of Americans love me.
So is Rasmussen completely illegitimate?
I mean, they have a right-wing bent to them.
Should I excuse everything that has a left-wing bent?
I mean,
should I?
If all the polls all say one thing, and you have Rasmussen here over there, going in a different direction.
Well, I was asking, should I do the same as you and just dismiss those that have a left-wing bent to it? Should I dismiss Daily KOs completely? What about a liberal writer from The Hill or Forbes? Or how about something from, what's another example? USA Today and US News, I think, is a little bit left-leaning in comparison to some others, at least.
They sure as hell ain't left-leaning when it comes to economics. USA, all the corporate media is basically on the right when it comes to economics. I mean, sure. So some of them, maybe even most of them, are on the left when it comes to social issues, because social issues don't affect how someone makes money.
So sorry, Brandon. We was getting echoes of ham in your audio.
Yeah, but I was muted.
Okay.
I feel threatened. He's pointing a gun at me. I feel threatened. I need my gun.
My question is, should I just dismiss those that have a left-wing bent to them?
I didn't say dismiss them.
Put your mouth on the barrel.
No.
Ham.
You're kind of implying that Rasmussen is uncredible because it has a right-wing bent, and I'm asking you, should I
didn't
dismiss
say anything about the credibility. I just said,
okay.
wow, that's incredible that single payer only slightly loses, on a poll agency that's widely known for their right-wing bent.
Okay, so I asked you earlier if I should just dismiss that.
I did not say anything about dismissing.
Okay, well, I asked, should I dismiss, or something along those lines. I can't remember my exact question.
I mean, you guys apparently do already.
Can I finish my point? And then you said, well, they have a right-wing bent. Instead of just saying an outright no, you shouldn't just outright dismiss them. It kind of seemed like an implication right there. That you're implying it, because they have a right-wing bent, then, yeah, maybe you should just dismiss them. I mean, a simple no would have sufficed. No, not necessarily, Zach. Anyway,
Zachy boy, fist me.
What?
Fist me.
Ham, put your mouth at the end of my barrel and start sucking.
Hey, how about you talk into the mic?
Is this any better?
Hey, well, where's your cum rag? Oh, wait a minute, you must be using it.
I don't need one, Ham.
No, he was talking to me, Brandon. But, yeah, I know. All I know is that you act like it's a done deal, and I don't know. I haven't researched enough to have a full undeveloped opinion. I mean, okay. I guess the question that I would ask is, I don't know. There seem to be multiple different definitions of what single payer means when it comes to single payer healthcare, because I think I recall a video from the Progressive Voice talking about how there are some forms of single payer healthcare where they have a private option. I even heard Switzerland supposedly be defined as single payer healthcare, even though they still have private insurers themselves.
Well, here's the thing. Canada is technically a public option, but they're single payers. But the government, the single payer system, outcompetes private industry, the private insurance companies so much so badly that all the private insurance companies went out of business or they moved elsewhere because the single payer system is just so much cheaper and so much better.
Well, that strikes odd to me. I mean, that it sounds like going off of all this, it would sound like you would more along the lines want the reform of Medicare and Medicaid than anything to here in the U.S. to kind of get to that Canadian-esque healthcare system.
If that's what it takes to get a single payer system here in America, why not? I mean, Medicare is extremely efficient with its funds. I mean, it's 92% of the money that it takes in goes to healthcare, where before Obamacare, the average insurance company, 50% of the money went to only about 50% of the money went to healthcare, and the rest of it went to profits and bonuses and big ass checks to the corporate elite. I mean, to the CEOs and top management.
I cannot remember exactly how I asked the question, but I remember in my first ever interview with you, Ham, that I asked you, what does single-payer healthcare mean to you? And I asked something along the lines, does it mean a complete and utter confiscation of private insurance companies and put insuring power into the government? And I thought you said that, yeah, that was something along the lines of how you think of single-payer, or the type of single-payer.
I mean, there's several different ways of doing it. You could you can have it where, the government completely takes over the hospitals and the doctors, and they just go from there. I think that's the kind of system that they have in the UK. Or you could just have it where the government completely takes over the role of the insurance company, where all they do is handle the money. And I'd be fine with that kind of system.
Or there is one where you have a private option and a public option. Does that fall under the definition of single payer as well, or am I mistaken?
Well, that's a single payer system with a private option.
Okay, well, I guess that's my problem with the whole single payer debate. Is that the term single payer healthcare seems ambiguous. I mean, we just put out like 3 different definitions there. One with the UK NHS style of healthcare. One where they just handle the insurance, but the hospitals are still private. And then one where there is both a public option and a private option.
I mean,
3 different definitions there.
I mean, it's not really all that different. It's still government pays for healthcare. You have a single payer for healthcare.
I think in Switzerland they only help subsidize the costs. They don't completely pay for it. They use the word subsidize anyway for it. I mean when somebody uses the word subsidize, that kind of implies to me that they don't completely pay the bill, but they only pay part of it at least. So
or maybe they do.
It kind of tells me that. It kind of tells me that Switzerland is like somewhat closer to the United States than it is to the UK. And yet it's like also propped up as one of the models that we should go for healthcare by all leftists. Anyway, I think I'm beat on the whole subject of single payer.
Yeah, the whole thing about single payer, America, I think, is the only modern nation on the planet that doesn't have a single payer system. We are a unique aberration in the world.
Okay, actually, now that I think about it, there's something else that I want to talk about. The 3rd definition of single payer that we brought up, where there's a public option and a private option. That seems to be roughly what I think of the United States. Like you have all the private options of, whatever health. I can't even name one off. Aetna. I think that's the health insurance that my company works with, and that I'm currently covered under right now. I'm not so sure. But anyway, you have options like Aetna, or you have the public option of Medicare and Medicaid. That sounds roughly like the 3rd definition of single payer that we presented right there.
Well, we don't have a single payer system. I mean, we kind of do for old people and military veterans, even though the VA doesn't work at all. But if we expanded Medicare to cover everyone, and reformed it to be a system more like Canada, UK, Switzerland, pick any single payer nation. I mean, if you still want your fucking private option that you want to spend twice as much as you don't need to, I mean, you can have that freedom, but I would rather a system that pretty much that guarantees you healthcare. I mean, even if you can't pay for it.
I think that if we were to have somewhat of a single payer system, that we could stand to not pay for it for like the rich or the upper middle class. And I don't think they need their.
I mean, if they want to exclude themselves, they can go right ahead. I mean, they can afford it.
Well, no, I'm thinking that they don't even have the option to get it publicly paid for, is what I'm saying. Not they have the option to pay for it privately if they want to, but no, they don't have the option. You don't get paid publicly at all because, hey, you're upper middle class or you're upper class. As long as you have the funds, we deny paying for you.
They still pay taxes. They still pay taxes. They're entitled to the service.
So with the single payer healthcare, even Bill Gates can still get his healthcare for free in your model.
I mean, he's a taxpayer.
So yes.
Yeah.
Okay. I'm thinking of ending this stream pretty soon.
Of course, someone like him probably wouldn't want to wait in in the single payer system. He probably want to, oh, I'm sick now. I want to get treatment now, and he'll probably go to a private service to get his treatment. I mean, that's probably what him and most of the rich would do.
Mm-hmm.
The option for single payer is still open to him. It's whether or not he takes it.
Mm.